be at their loved one's bedside when they're hospitalized. And all we wanted was to welcome visitors safely with appropriate screening methods and proper oversight to ensure they're wearing masks and practicing social distancing. The frontline staff inside has worked very hard to safely and effectively curtail the spread of the virus within our walls. Do you know why Cooley Dickinson fared so well during the first surge? Then I can tell you it's because of all of the skillful diligence of the frontline staff that work in this hospital.
Instead of gratitude for the sacrifices we have made to limit the spread of COVID, our wages and retirement contributions have been frozen, and the institution that owns us has decided rebranding and financing new billboards, pamphlets, and brand initiatives is a higher priority than providing even our negotiated wage increases. They have told our travel nurses meant to fill some of these gaps that we don't need them anymore, but our day staff have been mandated to rotate to night shift. Using COVID as an excuse to justify poor treatment of nurses and essential staff is capitalizing off of the goodness in our hearts to continue serving our community. Now we need your support to tell them we won't stand for this.
We're trying to make sure that we have adequate staffing, adequate resources. That's all we're asking for. And then to ask to be able to survive and take care of our families, is that too much to ask? While millions of stock options are being cashed in? I don't think so. I don't think so.
In this country, we value our workers, we value our nurses, we value our unions, and we're going to actually take care of the people who make our lives better, who make sure that we're safe, and who are going to get us through this crisis.
I don't know how they sleep at night. There isn't enough medication. That's all I have to say. With that kind of greed, there isn't enough medication. So you are here to remind them, and remind them every day that we must stand up. We must stand up and take it back, because no one's going to give it to us. I promise you that. Nobody's going to give it to us. We must stand as one. We must stand together. We must do this.
I am proud to stand with you. And I want to thank you for being here. You're doing this for all nurses in this country. When you stand out here, you're standing out for patients, you're standing out for nurses, you're standing out for other unionized workers. And that is something you should be